Hello friends, welcome to TechQuest channel. This is for the medical technologist by Your Tech. In this video, we will discuss about an enzyme amylase. What is amylase, where and how amylase is produced, what are the functions of amylase, reference range for amylase, increased and decreased conditions, test methods, interfering factors of amylase test, and linearity methods. In humans, amylases are produced by two organs, the salivary glands. The digestion of sugar starts from the mouth, and the exocrine pancreas. An amylase is 1,4-alpha-D-glucan or gluconohydrolase, an enzyme that catalyzes the hydrolysis of 1,4-alpha-glycosidic linkage in polysaccharides. Alpha amylase are calcium metalloenzymes synthesized in human, plants, and fungi. Beta amylase are present in the seeds, bacteria, fungi, and plants. Gamma amylase are present in fungi and bacteria. Amylase is present in number of organs and tissues in human. The greatest concentration is present in the pancreas, P-type. It is synthesized by the acinar cells and then secreted into the intestinal tract via the pancreatic duct system. The salivary glands also secrete a potent amylase S-type to initiate hydrolysis of starches while the food is still in the mouth and esophagus. Starch is the carbohydrate reserve of plants, the most important dietary source for human. Starch is a homopolymer composed of D-glucose units held by alpha-glycosidic bonds. Starch consists of two polysaccharides compounds, water-soluble amylose having long unbranched chain with 200 to 1000 D-glucose units held by alpha-1,4-glycosidic bond. Amylopectin is a branched chain with alpha-1,6-glycosidic bond at the branching points and alpha-1,4 linkages everywhere else. Amylase acts specifically on alpha-1,4 glycosidic bonds to liberate dextrins and finally maltose and glucose units. The optimum pH of amylase is 6.9 to 7. The salivary amylase hydrolyzes starch in the mouth and up to esophagus. Due to stomach acids, the amylase activity is stopped. The pancreatic amylase breaks down the polysaccharides in the small intestine. The pancreatic juice contains the bicarbonate ions that increase the pH to optimum for amylase activity. Serum amylase is used to investigate the course of abdominal pain or epigastric pain, differentiating between acute pancreatitis and a surgical emergency such as perforation of the stomach or infarct of the bowel. Reference range for serum. For newborns, it's 5 to 65 units per liter. Adult, 27 to 131 units per liter. For elders, above 70 years old, 24 to 151 units per liter. Increased amylase level is called hyperamylasemia. Pancreatic diseases, the P-type is increased. Pancreatitis, acute and chronic. Complications in pancreas, pseudocyst, ascites and pleural effusion, abscesses, pancreatic trauma, pancreatic carcinoma, neoplastic hyperamylasemia, usually bronchogenic or ovarian, usually S-type. S-type is salivary. Salivary glands lesions, mumps, calculus disease, S-type is increased. Disorders of complex origin, biliary tract disease, intra-abdominal disease, perforated peptic ulcers, the P-type is increased, intestinal obstruction, the P-type is increased, mesenteric infraction, P-type is increased, peritonitis, the mixed types are increased, acute appendicitis, ruptured ectopic pregnancy, the S-type is increased, aortic aneurysm with dissection, cerebral trauma, burns and traumatic shock, diabetic ketoacidosis, mixed types are increased, renal transplantation, S-type is increased, acute alcoholism, mixed types are increased. Decreased conditions: chronic pancreatitis, cirrhosis, hepatitis, pancreatic cancer, toxemia of pregnancy, cystic fibrosis. The interfering factors: ingestion of alcohol prior to the test, recent use of morphine that closes the sphincter of OD, heroin addiction. The urine amylase. The human plasma amylases are small molecules with molecular weight varying from 55,000 to 60,000. So the enzyme is small enough to pass through the glomeruli of the kidneys, and amylase is the only plasma enzyme normally found in the urine. In acute pancreatitis, the elevation of serum amylase lasts for only 3 to 4 days. It may be missed because of the timing of blood work. Urine amylase levels remain elevated for up to 2 weeks after an episode of acute pancreatitis. So the urine amylase can help diagnosis when the serum levels are borderline or normal. The amount of amylase clearance is measured in urines per volume in the specified period. Urine is collected in a clean container. The most span is 2 hours. 24 hours collection periods are also sometimes used. The 24-hour sample is refrigerated or kept on ice. Reference range for urine: 4 to 30 units in 2 hours, up to 3000 units in 24 hours sample. Test method: amyloclastic methods measures the disappearance of substrate and include the iodine starch method. Saccharogenic methods measures the production of sugars such as maltose and glucose. Most of the automated instruments use ethylidene block para nitrophenyl G7. The analytical range for serum is 2 to 1500 units per liter. For urine, 1 to 1500 units per liter. Linearity: amylase linearity materials are available from level 1 as 3 units per liter, level 2 755, level 3 1507, level 4 2258, level 5 3010, and level 6 6554. Pancreatic isoenzymes. The total serum amylase and the pancreatic amylase levels can be measured individually, and the salivary amylase level is calculated. This can give a better diagnosis of disease from the salivary gland or pancreatic origin. Reference for isoenzymes of amylase: the pancreatic amylase is 16 to 46 units per liter. Salivary is calculated from the total. Normally it's 4 to 61 units per liter. Thanks for watching. Please like, share to your friends in the lab, and subscribe this channel. Thank you.